So question here, the nurse is caring for a hospitalized elderly client who is admitted with pneumonia. So patient problem or got hospitalized with pneumonia, lungs infection, and the patient is elderly. Hmm? Which assessment finding is the most consistent with the diagnosis of delirium? This question is so easy because pneumonia, patient admitted with pneumonia, but the examiner did not ask any shortness of breath or oxygen, so we do not think that much. And this question second part mentioning assessment findings the most consistent with diagnosis of delirium. Most consistent with diagnosis of delirium. Examiner do not ask about pneumonia or patient is elderly, but I'm confusion. It is elderly patient dementia is common. Why suddenly delirium? To answer this type of question, every student must know what are the difference between dementia and delirium. I am sure every student know what is dementia. Dementia means forgetfulness, but this question not about the dementia. The dementia gradually onset and patient level of consciousness or vital sign usually unchanged. And dementia is a neurological disorder. Usually patient give a history of Alzheimer, but this patient do not talk about the Alzheimer. It is pneumonia, lungs infection. Also, dementia is common if patient have any brain injury. This patient do not have any brain injury. At least in the question does not mentioning. Or dementia also common in Parkinson disease, hmm, where this question is not about the Parkinson. And dementia is a progressive. So the family first identify the forgetfulness. And everybody know dementia is irreversible. But this question, not about the dementia, it is delirium. What is delirium? Hmm? So keep in mind, there are four options. Four options. So first of all, we have to know what is delirium. So if you know what is delirium, it would be easy to answer this question. Delirium actually the state of mind but distracted. So if anybody the distracted state of mind and that occur in some illness like fever. So if patient have a pneumonia, fever is more common. And I said delirium is a distracted state of mind that occur in some disease condition like fever or intoxication or any other disorder. And delirium is characterized by restlessness, illusion, and also incoherence of thought, abnormal thought, or distracted speech. This is delirium, not dementia. Dementia is a forgetfulness. This delirium is developed because of fever or because of pneumonia, and patient feel restless, abnormal thought and speech. Abnormal thought and speech. So there are four options. One, client is altered but disoriented of time. So as I told you, the patient client is all alert but disoriented of time. So it is not the feature of delirium. Hmm? Second one, client is inattentive and also hallucination. So I told you distracted about speech, patient restlessness, distracted about thought. Hallucination is the abnormal belief with perception, and client is distracted. I said it is question number two, inattentive, more closer, right? And now number three, the client report decrease the enjoyment in the previous desirable activity. It does not make any sense. So number four, family report of gradual progressive inability to remember recent events. It is regarding dementia, but this question about the delirium. Keep in mind the delirium is a reversible. So if patient disease, fever, or underlying cause is removed, their delirium will be okay. So I say delirium reversible if underlying cause be corrected. So delirium causes the secondary to a medical condition like infection or electrolyte imbalance, substance abuse. Pneumonia is an infection of the lungs. Patient develop fever. So infection, fever, and distracted of speech, or patient feel restlessness, and this is delirium, right? So let me read their explanation, what they said. The confusion assessment method, shortly called CAM, is used to determine the delirium. So this is the one scale, confusion assessment. The sign of acute mental status change that is fluctuate and inattention with disorganized thinking and altered level of consciousness. And the disorganized thinking include hallucination. So disorganized thinking, abnormal thinking, false thinking with perception is a hallucination. What is the difference between hallucination and delusion? Delusion is a only false belief without perception. The risk factor for delirium include older age or prior cognitive impairment, means mental impairment, or presence of infection, severe illness, or multiple comorbidities, dehydration, or psychotropic medication use, alcoholism, vision impairment, and pain. Delirium has an abrupt onset, rapid onset, but Dementia is a gradual onset. This is the difference between delirium and dementia. And dementia is progressive, irreversible, but delirium is a reversible if you remove the underlying cause. So up to 60% hospitalized elderly client have a chance to develop delirium prior to or during hospitalization, but it is often missed by the nursing. So now go education objectives. Everything, just little bit recap. Delirium has a sudden onset or rapid onset, involve the fluctuation the mental status. Why? Because of fever, because of infection, and also inattention with disorganized thinking or altered level of consciousness. So level of consciousness will be altered, vital sign may become unchanged. Also patient extremely distracted. It is very important because of secondary cause. What are the secondary or underlying cause? Means other illness. Dementia has a slow dementia now, has a slow onset or gradual onset. And usually the normal attention means level of consciousness and vital sign will be unchanged. And dementia related to the nervous disorder, neurological disorder. And dementia is common in Alzheimer patient, or patient give a history of traumatic brain injuries, or patient give a history of Parkinson disease. But this question do not about the Alzheimer, do not about the Parkinson disease, and also examiner did not mention the traumatic brain injuries. And also depression involved loss of interest or previously pleasure activities. So if any question about the depression, always we will get some clue like patient is sad, apathic, or suicidal ideation, personal grooming does not maintain, hygiene does not maintain, so many clues we will get. Especially the if any question come or if you deal with the patient who have depression, always try to find out they have any suicidal ideation or not because of safety priorities. So they said if patient have a depression related problem, we have to evaluate about the suicidal ideation, or we can ask some question. If patient have a depressive disorder, usually during the past month, patient give a more than 6 month history, and have you then you ask the question, have you often been bothered or by the feelings down, feel depressed or hopeless? Or during the past month, have you often felt minimal interest or pleasure in doing things you used to enjoy? You ask the question, it's called leading question, and you can easily exclude it from other medical problem. So this question, the client is a history or of obsessive compulsive personality disorder, shortly called OCPD. And this person looking for the treatment for gastrointestinal disorder, and they have a schedule for colonoscopy at 10 a.m. Due to some technical error, the hospital authority changed the time from 10 to 3 p.m. And it is sometimes it happen, right? So which response would be characteristics by the individual who have obsessive compulsiveness? This is the personality disorder as well. So OCPD, basically the patient has persistent thought, or they, because of the abnormal thought, they something do again and again, repeatedly they do. Why they do something repeatedly? To reduce the anxiety. So always patients are busy with themselves. Easy way to talk. So repeated thinking, this is obsession. And when they do something to reduce the anxiety or repeated thought, this is compulsiveness, right? So like I said, a patient thinking they have an infection on their hand and they're washing hand again and again. They're washing their hand again and again. This is because of obsession. When they do and wash the hand means they reduce the anxiety because of obsession and is called compulsiveness, right? So here said, if anything has happened with this patient, how they explain and what should be their response. Question number 1, how dare they change my appointment? But obsessive patient usually do not do this. The personality disorder like narcissistic personality disorder, they're supposed to do this, the response like this. Because narcissistic personality disorder are they're very arrogant, and then need for constant, they need to constant admire, everybody should be admire them, they like it, and they lack of empathy towards the others, sometimes grandiosity work. So it is not the nature of obsessive compulsive patient. This nature better met with narcissistic personality disorder. Question number 2, that's fine. I can come in whatever it is convenient for everyone. So number 2, actually a typical healthy person, not a mental related, but my patient is a already diagnosed obsessive compulsive disorder. So number 2, not for this. And here, this is, let me see, number 3 is the answer, but what about number 4 first? Why are they doing this to me? So this is actually suspiciousness, paranoid. So paranoid people is distrust others and always suspiciousness to others. So number 4, reflect somebody willingly to do this, right? So it is the paranoid nature. But in obsessive person, they, because obsessive person always focus on perfection, or they focus on order or any and control that may prevent the patient from any kind of completing a task. So they make a plan and they like to follow their plan. So number 3, it is unacceptable. I had my whole day planned out. Because of their obsession, because to reduce the anxiety, they do the compulsiveness. So they thought, I have so many things have to do. I will come again. It is destroy my day to, all day longs. So here, let me read their explanation. In individual with obsessive compulsive personality disorder are typically self willed and also obstinate, or they're very punctual and they like to pay attention to rules and regulation and need to control both external and internal experience. And this trait means character or nature are very extreme and result in rigidity and inflexibilities. So as a RN, when we deal with them, always try to help the patient set time limit for compulsive behavior. Hmm? Because this is the patient, they have a cognitive problem. So in this scenario, a change has been made in the client schedule for the day and is outside of the client control. And this could cause significant distress or impair function so that the client feel emotionally paralyzed. They disturbed, right? So always keep in mind, OCD patient need the cognitive therapy to help the patient identify some source of anxiety, because everything they do because of their anxiety, and anxiety that lead to compulsive behavior. So here, what are the educational objectives? An individual with obsessive compulsive personality disorder typically rigid and inflexible and has a need to control both internal and external experience. A change is a schedule that is outside of the client control could cause significant distress. So if you stop their thought, so that times it would be interrupt obsession behavior. If you ask me what are the treatment, so if we give them or provide the medication like SSRI, serotonin, reuptake inhibitor, or some anti-anxiolytic medication helps.